but really it seems like the best thing that's helped me has been physical therapy. It really kind of hasn't eliminated it, but it actually got some of my symptoms from my calf kind of closer up into my butt and my lower back. And I said, well, that's a good sign. So I explained to her about centralization phenomena. Surprisingly, when I asked her, like, what kind of movements were you doing? Not to throw the PT under the bus, because obviously I don't know what they were doing, but it was like right single knee to chest and posterior pelvic tilt. She goes, those are my core, like, 2 movements I was doing. And I was like, wow, okay.
It's almost
That's
lucky
great.
that you got centralization right.
Yeah, I'm not going to, again, throw him under the bus. It was maybe a movement preference for her, and that's what worked. And,
It's
I also,
possible.
yeah,
It's
I also
unlikely
explained to
when
her
it
that,
goes below. It's unlikely when it goes below the knee, but it's not
correct,
impossible. Yeah.
correct. I also explained to her, like, with time things do heal and, like, your system will, change and modify, and that, let's, let's go a little further. Let's dig deeper. So, knowing her scoliosis, I don't do a lot of work with scoliosis. So prior to meeting with her, I actually used Gemini to help me do a deep dive on the research to try to see what's out there, because I knew that in the past there was some literature on doing, like, particularly side planks and some, especially addressing, like, multiplanar movements, not just because in the old days it was just like stretch the tight muscles,
Right. We
strengthen the
used to
weak
think of it. We used to
muscles.
think of it as like a two-dimensional thing, like it's only a C or it's only an S, and it's pretty limited mindset actually. But yeah, that's how I learned. It's
Yeah,
like put him over a
yeah,
physio ball and
yeah.
strengthen the one side to stretch the other side, right?
Yeah. So it's like basically, oh, that's all it is. So it's like I know there's got to be more. And so sure enough, they mentioned the Schroth technique. And uh, apparently the Schroth technique developed by an individual named Schroth, and I believe the daughter now has taken over, and they do a whole certification process focused on scoliosis. And a lot of it is on auto fixation and trying to find the ability to self shift and try to come out of the scoliotic curve, not just in one plane, 2 planes, but in all 3 planes, which, being that this first time meeting this patient and me not being certified, I was coming in with the approach of, I just want you to be aware that we're going to try some movements today, see if we can help. And in fact, one of them is a movement you teach, which is just a side glide. And all I added in with it was a rotation with the pelvis. And that way she could get out of that transverse rotation for herself. And so basically correcting frontal and in the transverse plane. And then I just had her do anterior pelvic tilt to fix the movement in the sagittal plane. And she was like, wow, I don't have any pain down in my back of my thigh.